Welcome back to the Talking with Taylor podcast. I'm your host, Taylor, where we talk with anyone about anything, and hopefully everyone around the table will listen. And I am so excited for our guest today. His name is Dr. Crawford. We've known each other for some time now. We go to the same church. A lot of his kids are in the youth group, and we got, I think, two more in the children's ministry that's going to be coming up soon. And I can't wait to have them there. But Dr. Crawford is a doctor over at DCH, and he is just an incredible man, incredible story, and I'm so excited to have him on the podcast today. How are you doing, Dr. Crawford?
I'm doing great, and I appreciate the opportunity to speak with you today.
Absolutely. And your world, I remember, in March, we were trying to game plan our spring break mission trip. And I remember that Wednesday night very well. We were talking on the phone and talking, just trying to see what to do. And within 24 hours, the world stopped. I mean, it was the world stopped, and your world, being a doctor, being in the medical field, being a frontline worker, and we're so thankful for you and all you do, um, is has just been turned upside down. And so, how has it been being a doctor, an ER doctor, right? That's correct.
That's correct. Yes, I work in the emergency department at DCH Regional.
Yes, sir. And so, being an emergency room doctor during a global pandemic, how has that affected you, and how has things changed, and what are you guys doing to kind of combat the virus?
Our world has changed as well tremendously. If you had told me, a year ago that we would be doing some of the things that we were doing, I would have probably thought you're crazy. But our world has changed. We're seeing a lot of, our numbers actually in the emergency department. We're not as busy in the emergency department as we were a year ago. But you know, the the acuity level, the patients that we're seeing that are really, really sick has skyrocketed. So we're seeing really, really sick patients every single day. Not all of them are COVID, but a lot of them are COVID patients. So
Right.
we're those, we're now it's common for us to wear the PPE, the personal protective equipment, the mask, the eye shields, the gowns. Year 2 years ago, we didn't do that. Occasionally we would.
Right.
Uh, we wear that. We wear a mask from the time we walk in the emergency department to the time we walk out, other than when we're eating. And the sort of the higher level PPE, if we're going in on a patient that we think could potentially have COVID, they may or may not. But if we think there's a high chance, then we certainly wear that sort of higher level of PPE. So our world has changed as far as just logistically what we do, the PPE and the masks that we go through, and the PPE. If you're staying it for a long time, it takes its toll on you physically. I mean, especially if you're in a room with a patient, a critical patient that you're in there for 45 minutes or an hour. And I actually wear it's almost like a woodworking mask. That's a full face mask with basically a sort of a hat, a ratcheting hat.
Mm.
So if you wear that and a gown, and the gowns don't breathe very well, and two sets of gloves. If you're in that for an hour or so, you can tell. I mean, you're sweating, getting dehydrated, and you're getting hot. So it's taking its toll physically on us as well.
And that's something that people that are not working in the medical field don't realize. It's not just the mask that you guys have to wear. You, like you said, the gloves, the extra layers that guys have to put on to protect yourself, and it's just it's a virus that is obviously no one is immune from getting it. Our president just got it, so obviously this is a very contagious disease. And so you're a doctor, so I'm gonna ask you. I want to ask a couple questions about it. What are your thoughts on a potential, maybe a potential vaccine, herd immunity? I mean, all these words are being thrown out in the media. What are your thoughts on all those things?
Well, I think the vaccine, depending on who you talk to, some people will tell you that that there may be a vaccine in limited supply that may come out about before the end of the year. I think realistically, I think widespread access to the vaccine is probably going to be after the first of the year. The vaccine, from what I've read, is going to be a safe vaccine. The herd immunity, when we first started this, we thought that about 70%, 80% of the people would need to get COVID before you'd have, quote, herd immunity.
Right.
There was came out of New York that said that basically only about 20% of their population got, contracted COVID, and they're not really seeing a whole lot up there now. So they think that, did they get herd immunity when only 20% of their population getting COVID? Maybe, the jury's still out. But I certainly think that, initially, like I said, when we first started this, we thought 70%, 80% of the people would have to get it. Mm-hmm. And that may still be true. I don't know, but it's an interesting study that's coming out of New York with only 10 or 20%, 20% roughly of the population getting it. So, if that's the case, then that's very welcome news that we're not going to have to get 70, 80% of our population to get it. But again, right. But I do think the vaccine will hold some promise as far as cutting down on the transmission, just like any other vaccine, just like the flu vaccine, polio vaccine, et cetera. I do think long term it will cut down on the transmission of COVID.
Well, that's the overarching question throughout the media, and it's like you said, it's everyone's trying to follow the science, and I think that's important for everyone to do. It's like you said, the research they're doing in New York on the possibly if we could have obtained herd immunity with 20% rather than 70-80% is a great thing. That means it means like instead of having 80% of the population contracting the virus, only 20 had to contract it to gain herd immunity, and that's a good thing. What are your thoughts on? So we shut down. And that just the United States is definitely the American people. They have something in them, where it's kind of they don't like being told what to do. It's just a weird deal. And so the thoughts on the shutdown, if the idea was herd immunity, do you think the shutdown may have slowed down herd immunity, or was the shutdown kind of just a necessary evil to make sure our hospitals didn't get overrun? Like you said, the PPE, we didn't run out of that. Is that something we could kind of discuss?
I think you can look at it in two different ways. I think that shutting down, and let me say that all, not being politically correct, just being 100% honest, I think the shutting down was the right thing to do at the time.
With the knowledge that we had, absolutely.
I think it had to be done. Now, if you look and you think, well, herd immunity is 80% or even 20%, 30%, 40%, whatever number you want to hang your hat on, then I think that isolating people in their homes, away from everybody, away from the grocery store, away from Walmart, away from movie theater, away from school, etc., I think it does prolong that herd immunity. Right. Regardless of that, if it's 10% or 90%, I do think it prolongs the herd immunity or getting to that level. However, I think that you hit the nail on the head in that if we had let this move forward without isolating, without shutting down, our healthcare infrastructure, especially in the Tuscaloosa area, I don't think would absorb this. Now, you take a big city, New York, that's got tens of hospitals. Even then, they couldn't right. They couldn't weather that storm. But they were positioned probably, although their population is greater, they're more weathered or more positioned to weather that storm than probably we are with two hospitals. And I think we have done an excellent job here in Tuscaloosa.
I agree.
A great leadership all around, from the hospital, EMS, community leaders, fire, law enforcement, healthcare. I think we've had great leadership that has really kept the big picture in mind for the most part. And I think that if we had not shut down, we would not have fared as well as we did with our infrastructure. I think we would have filled our ICUs, we would have filled our hospitals up. That's my personal opinion. And then I think at that point in time, we would have had to make some really hard decisions. And I hate to use the word rationing healthcare, but I think we would have had to make some very, very hard decisions about some supplies and some life-saving equipment, such as ventilators. Luckily,
Right.
we didn't get to that point because I think the shutdown did help in that manner.
Absolutely. And I agree 100% with everything you said there, with the knowledge that we had and with what we knew about the virus at the time. The shutdown was absolutely necessary, and the shutdown saved lives, regardless of regardless of politics. The shutdown saved lives, um, and it was a tough decision all across the spectrum, whether it's Democrat, Republican, whatever. Our leaders had to make, and so and it's a tough decision. But being in a leadership role requires people to make tough decisions. It is what it is. Well, Dr. Crawford, I am so thankful for you and for your service and all the frontline workers that have every day, because this thing's not over with. This thing is still here.
Absolutely.
What are some, obviously we hear, the things that we need to do: wash your hands, wear a mask out. What are some other things that we can do to try our best to protect ourselves from COVID-19?
Well, I still think those are good suggestions. I think we still, good hygiene, things that our parents, things that our grandparents taught us to do when we were younger, as far as being sick. Cover your mouth when you cough into your sleeve, cough into a napkin. Stay away from other people when you're sick, and if you see other people that are sick, then steer clear of them.
Right.
Get away from them. I think people need to stay home when they're sick. I think the I guess the overwhelming theme of a lot of people is, oh man, I can work through this. I'm tough. I'm not going to let a little flu or a little cough slow me down or keep me at home. But I think in this case, we do need it to keep us home. I think if you're sick, I don't think it's a sign of weakness to stay home. I think that if you're saving lives and by staying home, you don't know. Yes, I may be healthy and you may be healthy, but if you're sick and then you're exposed to, a kid at church who then takes it home to an elderly grandparent, then I think it's just a domino effect. And I think
That's right.
that's bad. So I think the washing the hands, the social distancing, using common sense, staying home when you're sick, covering your mouth, getting plenty of rest, drinking plenty of fluids. I think all of those things still come into play. And I think it's really imperative that we do that as we move into the flu season, because we're going to get a double dose. We're going to have the flu going on at the same time as the COVID. So I think people need to get their flu vaccines. And so I think all of those things come into play. And I think people need to continue to be very vigilant in what they're doing in their everyday walk, throughout their daily lives, and that they just make sure that they're doing good common sense things to keep from spreading the virus.
Absolutely. And you hit on a key point there. It's not about being the tough guy or the tough girl or tough woman of quote unquote working through it. It's really not even about you. It's about the other people, right? It's about the people that you said you could spread to, and it's saving lives when you stay home when you're sick. And so I personally think if you know you have COVID, if you know, I mean, it, past the symptoms, but if you know you have COVID and you're still going out anyways, I think that's one of the most selfish things people can do and it's putting themselves over the rest of humanity. And so I would encourage people, if you have symptoms, like you said, if you have symptoms, if you know you have COVID, stay at home and save lives. That's right.
And wear your mask. I mean,
Yes.
I still see people that won't wear their mask, and wear your mask. I mean, if you're out and about and you can't maintain that 6 feet social distancing, then wear your mask. I think the mask is imperative. I think if you look back and you start looking, irregardless of the political correctness, if because there's been so many different opinions, and there's so much emotion tied up with COVID, and so much political emotion tied up in it. But I think if you step back and look at it from a scientific basis, the things that we have seen that have decreased the numbers go back to
Yeah.
Mask usage. I think the social distancing. I think, irregardless of what your political take on it is, from a scientific standpoint, I do think that has been the things that have helped the most in reducing the numbers.
It is. I agree, and I can think back. When Kay Ivey put the mask mandate on her state, what did we see a couple weeks later? Cases started going down, and it really might have not. At least, I mean, it's common sense, like you said. If you got a mask on, particles are not going to just fly out. It's going to at least deflect it, and so yes, sir. Well, hey, enough of the COVID talk. I guess everyone is, we've heard COVID, but those are some great reminders for everyone. And again, hey, thank a healthcare professional, thank a first line worker, because they're out there helping us, protecting us every single day. Well, Dr. Crawford, with the time we have remaining, let's talk about your family. 8 kids, right?
I have 8 kids. That's correct. Yes.
And how old's your oldest kid and your youngest one?
Oldest is 23 and the youngest is 7.
7. And okay. There you got 2 that are in the children's ministry, right?
That's well, actually we have Bradley and Baxley and Blakely are all in the children's ministry.
Okay, 3.
And 3, and then Briley is in the youth.
6th grader this year, right?
That's correct. Yes.
And then you got Barkley and Bentley in the youth group, and so that's a whole Bible study class for me to remember. So, and you guys just have an incredible family, and I really got to, we have a connection with Sharon Oakley that we didn't even realize we had till recently, which is, I love the Oakleys. They're like, aunts and uncles and cousins to me, and yeah, absolutely. And and Miss Sharon just she's working in recovery now. Is that right?
Correct. She transitioned out of the emergency department. We hated to see her leave. Sharon and my wife Sharman worked together in the emergency department years ago, and the whole time I've been back at DCH after residency for I'm in my 21st year there. So Sharon's been there the whole time, and I'm glad that she was able to slow down, but I certainly miss her, and I hated to see her leave. She was a great nurse, still is a great nurse, obviously,
Yes.
but a great emergency medicine nurse, great nurse, and just moved it to the recovery room. So we really, really miss her.
Absolutely. And we love that family and love her, and we love your family. And the story, is so all 8 of your kids are adopted. You've adopted all 8, is that right?
That's correct. Yes, all of them are adopted.
And the heart that you have for your kids and the adoption is incredible. Some people adopt 1 kid, 1 or 2. You guys have adopted 8, and I just think it's incredible. I love every single one of them, and just excited to have 3 in the youth group now and have 3 more coming up very soon. And so what led you and Miss Sharman to go down this path of adoption? Not just 1 or 2, but 8 children.
Well, Sharman and I we dated in high school. We dated for 5 years before we married, and we've been married in May will be 30 years. So Sharman and I have been married or either dating for over half our life, well, 3/4 of our life, I guess. And and we had, when I was in medical school, we had tried to have kids, and obviously I think that it was obviously the Lord's will that we not, because I think we have adopted those 8 kids, and I think that was the way we were supposed to go and what we were supposed to do. So we adopted our oldest as a newborn, and she's 23. She's recently graduated from Alabama and is about to start graduate school.
Awesome.
And has done really, really well in school. And then while I was in residency, we adopted our next one, and he's 21 now. And then when we came back, Charmin wanted to adopt another child, and I said fine. So we adopted Bentley as a newborn as well. And and then she didn't want an odd number of children. She said, I want an even number. She said, we get ready to go to Disney World or something. Somebody has to ride with somebody else or
That's
set
right.
out. And I said, well, fine, we'll do. And at that point in time, I had no idea. I thought the adoption agency was never going to let us adopt another child, just because there were other families wanting to adopt. And so the adoption agency came and met with us to update our home study. And as they're leaving, they said, hey, we've another family's picked y'all for another child. And that's when we got Barkley. And of course, will soon be 16. He's 15 now.
Yeah.
And so
incredible athlete too.
He's a good athlete. He I wish he cared as much about his academics as he did his athletics. But he's a good student too. He does really well, and he works hard. And Bentley does too. Bentley's a good baseball player. And they both work hard at what they do. And then so we had them, and then Baxley came along, and the adoption agency called and wanted us to adopt Baxley, and we did. And I thought we had enough at that point in time. I said, we're not going to do that. And I tell people all the time, every single one of those kids had God's hand in them in their adoption. And Baxley, especially because, I said, no, we're not adopting any more kids. We're not doing that. And the adoption agency called and said, well, will you pray about it and think about it? I said, yeah, I'm praying about it and thinking about it right now. No, we're not doing it.
Yeah.
And so they kept on, and we talked about it. And I finally, after a week or 2 weeks or so, I said, there's just God spoke to me just like you and I are talking right now. And, and I'm sitting there and I'm thinking, I'm 45 years old, 44 years old. I don't need another child, on. And God spoke to him and said, because he had been, we were talking about, Charmin and I were talking back and forth, and God spoke to him and said, somebody needs to love that child. And so he's 9 now. Has been a joy, just an absolute joy, as all of them have. And then we had a really good close friend that still are great friends of ours, adopted a little girl from China, and so she's a nurse as well, and she brought her little girl out to the ED, and I sort of fell in love with the little girl from China. So Charmin and I started talking about it, and we adopted one from China, and then
that's awesome.
Charmin and didn't want her to be the only Asian, and I said, matter. So she said, let's adopt another one from China, and I'm thinking, when's enough? But anyway, so we did that, and the adoption agency called and said, we have this little boy that really needs a home, and he was 6, and he was in an orphanage. So we went over and adopted both of them. So, but I did tell her, I said, don't answer the phone if the adoption agency calls back. I said, we're through. I said, so if they call back, hang up, don't answer the phone, whatever. It's been a blessing. Lord's blessed us in these kids. And we're just, we're trying our best to provide them a good home, a good Christian home, and teach them about Jesus. That's at the end of the day. I've told Charmin all the time. I say, I might die a broke man, but I do want to have at the end of, when I stand before God, I want Him to realize, and I obviously know He realized, but I want Him to say, you provide those kids with a Christian home and taught them about Jesus. I mean, that's at the end of the day, that's the most important thing. So
absolutely, and I can say from just being an outlooker, being a guy on the sidelines watching you guys, I know you guys do that, and man, you guys do an incredible job, and you guys have a wonderful family, and I'm blessed to be their student pastor and get to watch them grow up and become young men and women for the kingdom of God. And it's a blessing to have people like you in our church. It's a blessing to to see what God is doing in and through your family. And you hit on a key point here on adoption and on a, you know, just for a minute, we look at conservatives. A lot of conservatives say, we need to be quote unquote pro-life. All right, I like that word's thrown out a lot. But what seems to be the case is a lot of people are pro-birth, not pro-life. They say, hey, save the baby, but when the baby's born, what are they doing about it? Are they? I think there's a couple things people can do. Obviously, what you and your family have done is adopt, and that's definitely something people should pray about and pray through and consider. But another thing they can do is foster. They can be a foster parent, and if those two things don't line up, they need to look at some organizations that they can possibly give to and support. And not just throw the word around pro-life, because pro-life means the entire life, not just the moment of birth.
I agree wholeheartedly with that.
And it's it's something that has been as a testimony with your family that you guys have not just after the baby is born, you guys are pro-life all the way through, seeing your children be born, and not just born, but raising them to be kingdom leaders. And well, Dr. Crawford, our time is coming to an end here, and I'm so thankful to have you on the podcast. And Dr. Crawford, I know everybody in the community loves you, and I know they'll be so excited to hear this podcast. But is there anything you want to leave with our listeners before we go?
Well, I really appreciate you doing this. I always love to take any opportunity I can to talk about medicine, but but also adoptions. Sharma and I are as you mentioned, we're huge supporters of adoption. We have been, we always are open to talking to anyone about the adoption process. I think that's part of it too. Is we can certainly give guidance and to other people who are considering that. So, we take any opportunity we can to talk about adoption and talk about, our faith and what, and what God's done for us and it's continued to do in the lives of Sharma and myself and these kids. So, I really appreciate the opportunity to talk with you today.
Absolutely. And hey, we're going to have you on again. We'll have you on again in the near future. And for everyone listening, here's what I'm going to do. So if you have a question about adoption, I'm going to put our church information, our number, and my email on here. And if you'd like any questions about it, email me or call the church, and we'll try to get you guys in touch with Dr. Crawford and Ms. Sharman. Does that sound good?
That sounds great.
Well, everyone, thank you so much for listening to the Talking with Taylor podcast, and we hope you will join us again next time.